Many professional careers are cut short by injury to the thumbs, wrists, arms, so the invention of a tool that can allow you to do your job effectively and at the same time take most of the strain off the limbs was desperately needed. A number of small tools have made a small impact in this market, but the best friend allows your body weight to apply nearly all the pressure, while your hands remain in complete contact with the patient. Your hands are merely supplying energy, sensing, and guiding the tool. This tool is not intended to apply extreme pressure, of course, but to supply appropriate pressure. The tool consists of three basic components: an adjustable pressure shaft, a comfortable crutch to be placed against the various parts of the therapist's body to apply the pressure, a series of therapy implements that deliver the pressure to your patient. As a picture is worth 1,000 words, let's see your best friend in action. In the video to follow, you'll see the crutch end placed against the therapist, armpit, shoulder, chest, thigh, abdomen, or various areas to supply the pressure in the appropriate direction. Here I am applying effleurage, or stripping, to the posterior thigh, hamstrings. Notice that if I change my trajectory or angle of the tool, I can supply more specific pressure to the more medial semitendinosus or the more lateral biceps femoris muscle. Notice my hand position carefully. I'm not holding the tool as much as I am gently touching and sensing the leg and guiding the tip. For the sake of the camera, in some of the video you'll see me holding my hands away from the tip. This is only to show for the camera the position that the tip is in. All of the therapy is actually done with your hands completely touching the patient and touching the tool. Remind yourself regularly that your hands and arms are just touching, not supplying the pressure to your body. Your body weight is exclusively supplying the pressure. As is true with any new course you may take, many skills take deliberate effort to incorporate into your routine. So be patient and make yourself use the tools some with most of your treatments. Don't wait to be in pain or injured before using tools. Familiarity comes from use. With use, you will come to realize that this is your new best friend. Using is the effleurage tip or the T-shaped tip. In this area, I can keep one finger right next to the spinous processes in the back and keep the tool just into that lamina groove and get these erector muscles all across here. You can see that the tool will cover all of this. I won't dig this one into her ribs, but I'll just slide across nicely like this, and it's usually very comfortable. The round tip would probably be used to treat things like the quadratus lumborum, the piriformis muscles, upper traps. Notice that the different angles that you press the tool into the traps, for example, you can actually change by holding the tool against your thigh or against your abdomen or against your shoulder. This would apply to any of the body parts. The angle that you approach will be just as important to develop. So the tool can be used against the side of your hip as well. For example, if you were doing the tensor fascia lata. And of course, for the sake of the video, I'm keeping my hands away, but normally my hands would be right on the patient and I would be guiding it very specifically into the correct position. The pointed tip. Now this tip is pointed, and actually if you palpate the end of it, it's actually elliptical shaped. So I have it turned so that I can fit it right into the lamina groove and get those little rotator muscles. Again, my hands would be on the person, but just to show you how this is how we're going to be moving. In the case of actually using it, again, I've got my thumb or my finger against the spinous processes, and I can actually get that lamina groove and all of those little goodies that hide out right in the lamina groove. I can move my body angle a little bit to change my angle of entry. I can also treat the iliolumbar ligament very easily. Here with this is very, very effective. I can also treat along the edge of the SI joint with this tool. Again, my hands would be on the patient all the time for the sake of the video for you to see what I'm doing. I'm taking them off. This has been a brief overview of the best friend at work. We expect it will last a lifetime and extend your career many years. In the future, you will look at this as the best investment you ever made.